Hi, I'm Robert Homm, one of the providers here at Fertility and Endocrine Associates. Fertility, and particularly pregnancy loss, can be distressing for any couple struggling. Pregnancy loss at any time is obviously distressing, but particularly distressing to couples that have worked so hard to conceive. Unfortunately, pregnancy loss is fairly common in human reproduction. Somewhere between 1 in 4 to 1 in 7 pregnancies can be lost once recognized. Even more distressing for a couple struggling with infertility is recurrent pregnancy loss, something I want to address briefly today. 2 pregnancy losses are relatively unusual, but can occur in approximately 5% of couples. 3 pregnancy losses in a row without an intervening successful pregnancy is even more rare, approximately 1% of the time. What we would think about in a couple having any pregnancy loss is obviously an explanation for why. But particularly after 2 or more losses, what we refer to as recurrent pregnancy loss, we want to initiate a thorough evaluation for the causes and implement treatment if possible. Some of the things we think about in regards to recurrent pregnancy loss is first of all genetics. Genetics, or how the chromosomes of the male and female arrange to create a new human being, is complex. But we know that pregnancy loss in general is many times related to just an accident of fertilization. What we're looking for in couples with recurrent pregnancy loss is a situation where one of the individuals of the couple actually has some type of rearrangement that they may not even be aware of. So simple blood tests can uncover that problem, and with that information and the advent of in vitro fertilization, we can actually determine whether or not an embryo is normal or abnormal before we were to transfer it to the womb. And that has helped many, many couples in our practice. Another possible cause for recurrence of pregnancy loss is undiagnosed endocrine problem. Things such as low progesterone, abnormal thyroids, panels, elevation in a hormone known as prolactin. These are all etiologies of pregnancy loss that we can overcome when thought out and searched for with simple laboratory. The other most common abnormality that we see is a metabolic disorder. And unfortunately, we see this with patients that are struggling with their weight. Undiagnosed diabetes, along with that, insulin resistance, in some cases, frank abnormalities in the metabolism of some of the hormones. These are things that we have the expertise and knowledge to help uncover and correct here at Fertility and Endocrine Associates. Another common cause that we look for any situation of recurrent pregnancy loss is a survey of the uterine cavity. This can be done with a simple vaginal ultrasound, or in some cases, diagnostic ultrasound such as saline-enhanced ultrasonography, or in cases where more complex abnormalities are suggested, surgery such as hysteroscopy combined with laparoscopy. Another abnormality that we occasionally see and search for in patients that have had 1 or more losses are conditions such as thrombophilia, which is a coagulation disorder, particularly mutations in factor 2 and factor 5. These can be very gratifyingly treated with successful outcomes in 60 to 70% of the time. Other abnormalities are immunologic, something called anti-phospholipid syndrome. These too are just simple blood tests which, if properly evaluated and interpreted, can be appropriately treated, many times preconceptually or early in the pregnancy with successful outcome. So couples, again, with recurrence of pregnancy loss, many times will have this thorough evaluation, and in up to 50 to 70% of the time, no direct etiology is found. The good news is that the vast majority of those couples will conceive in the next pregnancy with an ongoing pregnancy. If not successful, then we certainly understand the anger, the guilt, the frustration, the isolation that can occur with recurrence of pregnancy loss. We have the knowledge and the experience to help you. If you have any questions in these regards or any of the other facets of reproductive endocrinology and fertility, please give us a call. We'd be glad to try to help you.